Welcome back, everyone. Hope everyone had a nice lunch. Okay, so in the afternoon session is going to be focused on the work that we're doing here in Houston. The moderator for this session is Dr. Chad Wilson. He is the Trauma Medical Director at Ben Taub, which is a very, very busy trauma center here in Houston. And joining him is his colleague. He will be introducing her. One of our speakers was unable to make it, Deborah Mendoza. She was going to talk about some of the violence intervention programs in Dallas that have been pretty successful, but unfortunately she was unable to join us. And then following that, we've lined up a very exciting panel of people that are doing violence intervention programs, community-based programs in the city of Houston and in Harris County, and to try to get us, the rest of us that don't know what's going on, to try to get us to understand all the great work that's going on in our city and our county, and how we can work together. So thank you.
All right, step down, okay. Well, good afternoon. It is a privilege to be here. I am the Trauma Medical Director at Ben Taub. I just actually came out of the operating room about 45 minutes ago. And it's nice to see so many people who are interested in the public health problem that is something that I deal with on the microscopic level. So this is just, this really is heartwarming for me personally. So let me go ahead and get started by introducing our first speaker. So our first speaker is Dr. Catherine Seeger. Dr. Seeger is a native Houstonian who is an assistant professor of surgery in the Division of Trauma, Acute Care Surgery at Baylor. She is the associate program director, meaning she helps me do all my work, of our trauma center at Ben Taub Hospital. And she's also currently in charge of the residency curriculum for the Department of Surgery. With no further ado, Dr. Seeger.
All right, good afternoon. Thank you so much for the opportunity to present here today. I particularly want to thank Baylor, UT Health, and the Baker Institute for inviting me to speak here. By way of introduction, I'm Catherine Seeger. As Dr. Wilson said, I'm a trauma surgeon who works at Ben Taub, an assistant professor at Baylor College of Medicine, which is one of the 2 level 1 trauma centers, meaning the highest acuity, or the trauma center is able to serve the highest acuity of patients that serve our city. I don't know how this works. Okay. I have no disclosures. There's a key. Okay. It's fine. I want to start by saying I'm from Houston. Dr. Wilson stole my thunder a little bit there. I was born here at St. Luke's Hospital. I graduated from St. Agnes, came back for medical school, which I did at UT Health, now it was UT Houston at the time. Did my residency training at Baylor. I subsequently took a brief hiatus in Tennessee for my fellowship training in my first couple of years of practice. But it was always really important to me to come back and serve this community. Because of that, addressing firearm and interpersonal violence in our city has always been extremely personal to me. So just stepping back a little, you guys have heard a lot today about the scope of gun violence, particularly in our city, but looking on a little bit more of a national level, let's just, see kind of what's been going on the past several years with gun violence in the country. What we're looking at here is basically age-adjusted death rates for firearm violence across the United States by state. To briefly orient you to the schematic, the lighter blues on the map represent lower rates of firearm-related deaths, and as the blues get darker, they represent progressively higher rates of deaths from firearm injury. And this is just a map of those rates by state nationwide in 2020. This is 2021. So pretty much across the board, but most dramatically in the central and southern U.S., those rates increased, and not insignificantly in most cases. So clearly, the reason we're all here gun violence is a public health issue, is just getting worse. Now I want to take a little bit closer look at some of our local numbers. This is Bentop specifically, so this is what we saw at our hospital over the past 3 years. You can ignore the gray columns. Those are just the total trauma activations per year, so all comers, be them car wrecks, falls, things like that. But the blue columns represent the total number of those patients who presented after a penetrating traumatic injury, so meaning either a firearm injury or a stabbing usually. So as you can see, every year we saw an increase in the number of those injuries. Importantly, this does not account for any patient that was seen at any other hospital in the city of Houston. It doesn't account for any patient who chose not to go to the hospital after their firearm injury, and obviously, you know, nor does it account for victims of firearm violence that never made it to a hospital in the first place because they died on the scene. A little more about Bentop specifically. You know, what I'm here to do today is talk to you a little bit about what it's like to be a trauma surgeon at a level 1 trauma center serving the 4th largest city in the country. To start, the trauma centers in Houston are busy. The American College of Surgeons, which is the governing body that's responsible for verifying trauma centers, recommends usually that you have one level 1 trauma center for about every 1 million residents. Houston has only 2 for the region. So at Bentop specifically, we see about 4,500 trauma activations a year. We've seen generally sustained yearly increases in those patients. And again, you know, as I briefly alluded to before, that's all comers. That's not just firearm violence, but it is a busy trauma center. The rate of penetrating trauma nationwide out of all traumas is about 12 to 18%. So of all patients that are traumatically injured, that percentage tend to be shootings, stabbings, and things of that nature. At our hospital, the percentage of patients that we see that have penetrating injuries is about 25%, which is pretty high. And certainly, you know, a higher percentage, as I said before, than represents the actual population that tends to be injured by that mechanism. Just sort of by way of comparison, at most trauma centers, that rate is about 10% by what they see. So what does that look like on a day-to-day basis? A typical call day starts like this. At around 6:30, we gather for our morning sign-out. Here, we all come together, we discuss the previous day's admissions, we make sure any important clinical information is conveyed to the new team of people taking care of the patients, and discuss plans and operations for the upcoming day. In a perfect world, this is an uninterrupted 30-ish minutes, you know, sometimes longer, depending on how busy the day before was. But in reality, it's really not unusual for the business of the day to be interrupting this conference. And it's interrupted by things like this. So yes, we still use pagers, but the beauty of living in 2022 is that all of the traumas also get sent to our phones. So I can share with you a few of the recent calls myself and some of my colleagues have responded to. This is just a small collection of what we've seen come into the hospital over a few days in the last couple of months. I've redacted the dates just to protect patient privacy, but this is not edited. So what I didn't do was get rid of car wrecks coming in between the gunshot wounds and in between the other things, or any other blunt traumas that may have come in to interrupt sort of the firearm violence. I'm not going to say I didn't use our busier days. I did cherry pick a little, but I wanted to make sure to demonstrate to you guys what we're seeing at our hospitals on a regular basis. So now I want to just take you through a couple of patients that I've taken care of during a recent call. So this is a gentleman who came in, paged out as a middle-aged male who had had a gunshot wound to his chest, reportedly had normal vital signs on his way to the hospital, but was unresponsive. As a trauma surgeon, I can tell you immediately that's a little suspicious sounding. But upon arrival to our hospital, it was noted that he did not have any pulses. So this is probably the most dramatic scenario that we as trauma surgeons get. When we see a patient like this in the emergency room who's been shot and has basically died immediately prior to arrival or immediately when they arrive to us, they get the full court press. Surgery starts immediately. That means in the emergency room, down where we see the patient. Because in a patient like this, that's the only way to try to save them. I'll try not to get too much into the technical aspects of this, but a combination of things kill these patients, particularly ones that have been shot in the chest. One, they're bleeding to death. Two, blood that escapes from their heart can press down on their heart and prevent it from filling. And three, any remaining blood that they do have is really just not enough to fill up the heart and be pumped out of it to the rest of the body. So obviously, this patient met that criteria. We open his chest in the emergency room to get access to his heart and to the big blood vessels leading out of it. We were lucky in this instance, and with blood transfusions, release of the blood pressing down in his heart, and clamping of his aorta, his heart started beating again. At this point, all we've done is get to a place where we can start the surgery he actually needs. What we ultimately found in the patient was 2 holes in the upper chamber of his heart, which fortunately we were able to fix. This particular patient ultimately did pretty well, given what had happened to him. He woke up, which is never really a given in this scenario, although his road to recovery will be really long, but he'll likely be discharged from the hospital. Shortly after this, we were alerted to the impending arrival of our next victim of gun violence for the evening. And this is the information we get in this scenario. We have a 20-ish-year-old male who has multiple gunshot wounds to the abdomen, who's combative and who has low blood pressure. Once again, our team mobilizes. We meet the patients downstairs in the trauma bay, which is where all of the most seriously injured patients are dropped off. On our assessment, he's panicked. He's fighting the people trying to take care of him, which is never a good sign. He has multiple gunshot wounds to his abdomen and severe abdominal pain, and his blood pressure is low. So he's sick. A patient like this needs surgery right away, but at least this time we have the opportunity to move him to an actual operating room to start his operation. So we go to the OR immediately to explore his abdomen. He had multiple injuries to several different segments of his intestines, which, you know, in terms of injuries are easy enough to fix. But of greater concern, he had multiple injuries to the large veins that drain blood from his legs back to his heart and lower body. We were able to fix the holes in the injured vessels and temporarily address the injuries to his intestines. But just because we were able to stop his bleeding didn't mean he immediately got better. Part of being a trauma surgeon is not only moving quickly, but knowing when to bail out. So when a patient's core temperature drops below a certain level or they remain too unstable to stay in the operating room, we have to make the decision to come to a safe, albeit temporary, stopping point, cut our losses, and bring the patient to the ICU to try to fix the other problems with their abdomen still open before surgery is actually finished. It was very clear that this guy was in this group. He was too sick to stay in the operating room for a complete surgery, so we got him moved to the ICU with the hopes that he would live to fight another day. Again, this was a good day for this guy. We were able to stabilize him enough to take him back to the operating room several times over the next few days, get his surgery finished, and his abdomen closed. He has subsequently been discharged and is doing well at home. Our last patient is a middle-aged male who was paged out as being awake, had suffered a shotgun wound to his abdomen, but had low blood pressure. This would be our last patient of the night. When he arrived, he was awake, he was talking, but his blood pressure was very low. He had a very large wound on his abdominal wall with wadding in it, which would suggest that the gun was just very close when it was fired. And he, like the last patient, needed surgery immediately. So he got blood started and was transported again immediately to the operating room. As you guys can see in this picture above, there are pellets everywhere. He had numerous holes in his stomach and his intestines. What he also had were really innumerable holes in the blood vessels that fed his intestines. In addition to this, it was clear that some parts of his bowel were already not getting enough blood to survive and needed to be removed. So we quickly resected these portions, meaning we took them out, tied off and packed the bleeding vessels to the best of our ability. And this particular patient was so sick at the time of surgery that we were not even able to address all of the holes in his stomach. So he, like the last patient, was closed temporarily and taken to the ICU. In the ICU, he remained very unstable, although he initially improved somewhat. A few hours later, he suddenly declined again, so was taken emergently back to the operating room in an attempt to continue his operation and make sure that he didn't have any, additional injuries that needed to be addressed in the short term to get him through this illness. The holes in his stomach were closed at this time, some additional bowel was removed, and he was once again returned to the ICU to hopefully allow his physiology to recover. As before, he improved briefly, but again, after another several hours, he had yet another precipitous decline. At that point, he was once again taken back to the operating room. At this operation, all of his remaining bowel was dead. For this patient, this is the end of the road, because there are certain injuries that we just cannot do anything about. And this is one of them. When all of someone's bowel is dead, all we can do is allow them to die comfortably and be with their family to the extent that we can. So at this point, he was brought back to the ICU for the last time. We discussed what we found with his family, and once they had had the opportunity to gather at his bedside to be with him, his care was transitioned and comfort measures. He remained awake until his death with his family at his side. So sadly, days like the one I described are often the rule and not the exception. And I think we can all agree that that's becoming more and more common the last few years. So, a couple of things here. How can we as a healthcare community contribute to decreasing gun violence in our country? That is, what role can we play as physicians and hospitals in helping decrease these rates? And really, the big thing I want to talk about with that is hospital violence intervention programs. So I told you a lot about the clinical course of these patients. What I didn't tell you about was the circumstances under which they had their gunshot injuries, the social circumstances from which they came, and what we did as a hospital to try and get the ones that were able to get out of the hospital into a different environment than the one that they came from in order to potentially prevent this from happening again. And that's because right now we don't have an infrastructure at our hospital, I believe neither does Memorial Hermann, to really provide that service to patients. So according to the CDC, homicide was responsible for 19,362 deaths in 2016. In 2020, that number was 24,576. In Texas, there were a little over 2,200 deaths due to homicide in 2021. Although the social and economic costs of homicide are really significant, non-fatal injuries, violent injuries, actually outnumber fatal injuries by more than 100 to 1. So many victims of violence are at increased risk for re-injury. This is something we know. In urban settings, it's estimated that up to 41% of patients treated for violent injury are re-injured within 5 years. One survey of victims of violence at 5-year follow-up found that 20% of the patients treated for violent injury had subsequently died, usually of a violent mechanism. Most hospitals send patients out like I discussed before, into the exact same environment that they presented in. So there really is nothing that we're doing to address the likelihood of recidivism in these patients, which is really, really high. So it seems to follow that one place we can enact positive change is during these patients' interactions with the healthcare setting. So this is widely considered a teachable moment. I don't love that terminology. I think it sounds a little paternalistic, but it's, you know, it's kind of just the widely used terminology for that. But studies have certainly helped show that this is the case. It's a point in time where people are receptive to interventions that promote positive behavior change. And again, you know, reaching them during these so-called teachable moments is really key to a successful hospital-based intervention. So basically, instead of waiting for the patient to seek care, therapy, for any of the things that contributed them to be, that contributed to them being a victim of violent crime, we bring trauma-informed care to the patient at the point of contact. As an aside, I'm not sure if you guys will get any of this later, but trauma-informed care is basically the recognition that the trauma is not just the physical injuries that somebody shows up to your hospital with. That is, that people presenting after violent victimization are also victims of chronic traumas that are present in their daily lives, and that we really have to get a complete picture of what a patient's life looks like outside the hospital in order to treat them in the most, holistic way. We also need a significant sensitivity to that while we're addressing their acute issues to truly provide the meaningful healthcare that can change their course in the future. So there are a number of well-known examples of these programs around the country. I would say probably the most well-known is the Wraparound Project at UCSF that was started by Rochelle Dickers. If you know, anybody here has any interest, I would really encourage you to look up that program because it's pretty comprehensive. But what exactly is a hospital violence intervention program, and what does it entail? So these are really what are considered to be the components of a successful hospital-based violence intervention program. And this is just a social ecological model of violence prevention that was adapted from the CDC. So the ideal hospital violence intervention program provides intervention at multiple levels to prevent interpersonal violence from one, as we discussed a little in the previous slide, patient contact at the initial interaction, to continued social programs and support after discharge from the hospital, as well as contributions to community outreach and policy advocacy to address certain social determinants of health. So these should really have 4 major components. The first being intervention. So this is just a brief intervention in the emergency department or at the hospital bedside. Again, this is what happens when they're in the hospital. This is when you figure out who somebody is, where they came from, what contributed to their problem, and start to formulate a plan for what they're going to need after they leave the hospital. The second being care, so that's intensive, long-term, community-based case management services that continue in the months following the injury. So this is not something they just get when they're with you and then goes away once they leave the hospital. Also important, they subsequently have follow-up services, so crisis intervention services, linkage to other community-based services that are not just solely case management based, mentoring, home visits, any follow-up assistance they may need. And, you know, really importantly, this has to be provided by culturally competent frontline workers. A lot of our patients come from a population that has a lot of mistrust in the medical community, a lot of mistrust in, you know, government programs, and you know, for very good, very valid reasons. So in an ideal world, this is really people from these individuals' communities that they can have an actual trusting relationship with. And then lastly, you need to address the social determinants of health. So conditions in the places where they live, learn, work, play, all affect a wide range of health risks and outcomes, and violence is not an exception to this. So how do we create hospital violence intervention programs? A group from the American College of Surgeons Committee on Trauma, Injury Prevention, and Control was tasked with outlining a comprehensive approach. Again, this charge was led by Rochelle Dicker, who's done really a lot of work in hospital violence intervention programs. But this is just sort of a summary of the concepts outlined in what they discussed and what their primer is. So right now, we're at step one. Dr. Naik, who you guys all heard from earlier today, in conjunction with the Baker Institute, is the primary investigator for a CDC-funded study that is really going to build what's probably going to be one of the largest and most comprehensive and most granular databases that defines victims and circumstances of firearm violence that'll exist in the country, and it'll be about patients in Houston. Hopefully this conference represents part two starting to come into play as well. So we're all here together today to talk about what we can do moving forward to address this problem. So moving forward, projects like these, again, is going to help move toward the goal of helping victims of gun violence in our community on a more global scale. So that's all I have. I want to thank you guys again for the opportunity to present. And if you have any questions, I'm happy to answer them.
All right, well, if you guys can save your questions, I think we're going to have the Q&A after the rest of our presenters for this session finish. Dr. Seeger, thank you for that sobering depiction of what your life is like as a trauma surgeon. That was powerful. If I just may take the privilege of the podium to just brag on Dr. Seeger. I mean, as you probably were able to realize, she's an incredibly gifted technical surgeon. But the thing that's special that you don't always find in surgeons is the care, which is something she has in spades. So this is who I want to be on call if I get hurt. I mean, I love all my partners, but so moving on, and correct me if we were going to do this a different way, but I think I'm going to we want me to introduce them one at a time? And okay, perfect. All right, so we're going to move on into the review of some Houston community violence prevention programs. And we're going to start, I believe, with Lupe Washington. Yes, come on up. Lupe Washington is the Division Director of Harris County's Community Health and Violence Prevention Services, which provides strategic direction, oversight, and implementation of efforts to address the root causes of pressing public safety challenges through a public health approach. And we got your slides?
I think so. Awesome.
Great.
I'm a little short. Good afternoon. It's really a pleasure to be here this afternoon. Like you said, I am with the Harris County Public Health Department, and I'm really excited to talk about what we've been doing in the last 6 months since I have assumed this role. I started in mid-December. I was charged with starting a couple of programs by March. And so when my boss gave me that charge, we're like, of course, yeah, we're gonna make it happen. And so we have. I'm really proud to talk about our first program, the Holistic Assistance Response Team, which is we call our HEART program. This program is in the Cypress Station area. It's in the northern part of Harris County, and this is where we are contracting with a provider, and we have teams of 2, a certified EMT and a crisis intervention specialist who go out and respond to nonviolent calls. We are working in conjunction with the Harris County Sheriff's Office. They've been wonderful partners in this, and they're the ones who run our 911 response program for the county. And our partners have responded to 275 calls since we launched on March 21st. These are all nonviolent calls, so these are calls that our sheriff's officers have not had to respond to. And the idea is that our law enforcement partners can go out and respond to the more pressing violent matters in the county. And again, it is a pilot program. All the programs I'm talking about today are pilot programs, so we're just getting started. And so again, our HEART program, they have their own unique vehicles. They don't look like law enforcement vehicles. They have their own uniforms. They're wrapped, and they're actually purple, real pretty. Some SUVs and a van. And our community partner actually went out and they have rented a space near the Ponderosa Fire Department so that could be closer to the area, so when they report, they're ready to start receiving calls right away. We are going to expand. We've responded to 275 calls, and that's just for the most part, having one team of 2 out there from 9 to 5. So when we increase the number of teams, we're hoping to respond to more calls. We also have our community-based violence interruption program. This is where we are hiring outreach specialists in other jurisdictions. They're known as violence interrupters or credible messengers. Like was said earlier, you really have to have people from the community who have lived experience. Those are the people who our residents are going to be able to connect with best. And I'm happy to say that our 2 newest outreach specialists just last week were able to mediate a conflict and prevented a gun violent incident from happening already in just their first week out in the field after their week of training. We are contracting with Dr. Chico Tillman out of the University of Chicago for his expertise and training of our staff, considering there is an element of danger to doing this type of work. This program is being piloted in 4 zip codes. 3 of them are inside the city of Houston, and 1 of them is in the county. And it includes as Sunnyside, South Park, Greater OST, South Union neighborhoods, as well as the Cypress Station area. And so that's where our staff are. Again, I've been very happy that in 6 months I've been able to hire more than half of my team to do this work. And so as our outreach specialists are trained, they're out there, they have a passion. A lot of them are justice impacted themselves. So yes, some of them do have criminal histories. However, there are some incidents where we're not going to be able to hire them if they have something against children, if they have a crime, anything against children, the elderly or the physically disabled, we're not going to be able to hire them. And also, we're not going to hire anyone who is a registered sex offender. Going to our hospital-based violence interruption program, we are partnering with BENTOB. We are having weekly meetings with the Health Alliance for Violence Intervention. That's who we are contracting with, Javi, to develop this program at BENTOB because it is our level 1 trauma hospital. And we are going to have outreach specialists in the hospital responding to individuals who have been the victim of violence, or gun violence, going to BENTOB. Again, the same 4 zip codes that we are servicing for our community-based program, those are the same 4 zip codes we're going to work with for the hospital-based violence interruption program. So we're really hoping that we're going to get that up and going here very quickly, although we are also being approached by HCA Northwest in Cypress Station to start this similar type of program, and because they're not needing any kind of funding, they're just eager to get started. I think we're going to be able to work out that interlocal agreement a little faster. So we're excited about being able to start that. Another program that has been assigned to our division is the CEPTED program. This is crime prevention through environmental design. We have 5 areas across Harris County that have been identified. It was put in our division because 2 of those areas are already areas that we're in. There is a lot of community engagement that has to take place, and again, we've already started that with the other programs that we have. We are going in asking the community, do you feel safe? What do you like about your neighborhood? What would you like to change? The idea is that we can have more sidewalks, better lighting, perhaps cameras if needed. Whatever is going to make our community members feel safe is what we're going to go out and try and do. The CEPTED program is being funded through ARPA funding, so those are federal dollars. The other programs are being funded completely with our general funding from Harris County. So our Commissioner's Court approved through general funds to fund the majority of the division. And then the last program that we're pretty excited about is a pilot program that we're going to have with our DA's office. They're going to divert, we told them we could just take 100, even though they said they had about 5,000 that they could divert. We're like, okay, we're just going to start with 100. And we are going to work with these low-level offenders to, again, connect them with services. At our department, our executive director is really big on us not using the word referrals. We don't like to give residents a phone number. Hey, good luck, call them, let me know if you get connected. we are actually charged with connecting people to services. We want to make sure that our residents, you know, are not getting the runaround. Let's face it, for some of us who are educated, it's difficult to navigate certain services and resources. So we understand the challenge that it is for our residents who need our services, so we're going to help them make those connections. And so these are just the programs that we have in our division. And let's see if I can work this. So some of our ongoing projects that we're really excited about, our mobile units for the health department have been out since the beginning of May at the apartment properties in Cypress Station that have had the highest rates of gun violence. And so we've been out there twice a week providing immunizations, vaccinations, and on Thursdays, HIV services as well to the residents. It's amazing what the need is in the area. We want to meet people where they are. And so we've been really fortunate to be able to go out there to those 2 properties. I just got a message from my staff about an hour ago. Just today, we were able to make contact with 75 residents and give them services that they needed. So we're really excited about that. Again, these are the properties that have had the highest rates of gun violence. In Commissioner's Court, earlier in May, passed a resolution making June Gun Violence Awareness Month. And so we are going to culminate the month with a larger mobile health fair out in the Cypress Station area at Lentz Park on Thursday, June the 30th. So we have a number of our mobile units out there that are going to come out. We're hoping that Precinct 1 is going to be able to provide some transportation from the apartment properties for the residents to the park. This is one of those areas that's on our CEPTED program because there's no sidewalk from those apartments to that park. So we're hoping that that's one of the things that we're going to be able to fix through the crime prevention, through environmental design. We are working in partnership with Precinct 1. They've been very instrumental in helping us launch our programs and being present in at our community engagement meetings. There's a lot of community engagement that began in early January and is ongoing. And we have also partnered with the Sheriff's Office and their community problem-oriented policing team. Again, we are having a gun violence awareness health fair, but we've also are going to begin, it just got approved last week at Commissioner's Court, a countywide violence prevention campaign that's going to come out of our office. So you'll be seeing some billboards coming out of our office as well. And then last but not least, we're having our own violence prevention conference, a 2-day conference in August at NRG. We've already do have some of our headliners. We will have Charles Blow, Ben Jealous, Liz Ryan, who's the director of OJJDP, and we're going to have the awesome Dr. Chico Tillman, who's going to close us out. And in between, we're going to have a lot of other phenomenal speakers. And if you'd like the link on how to register as a professional, just get in touch with me, and I'm happy to send you that link. And I think that's all I have today. Thank you.
Okay, our next speaker is, I believe, going to be Carlton Harris, who is the Executive Director of the Forgotten Third Incorporated, which I believe is a juvenile justice intervention credible messenger program and with a focus on gun violence, gang violence, and dating violence.
Good afternoon, everyone. A little bit about myself, Carlton Harris. Recently was working for the City of Houston, the Houston Health Department. I oversaw the Houston Peace Youth Violence Prevention Initiative, where I helped author our strategic plan, which is focusing on preventing youth violence, promoting youth health, and providing youth opportunities. And under the Prevent Youth Violence, there are 8 objectives: promoting youth health, 4 objectives, and providing youth opportunities, 4 objectives. The main goal for Houston Peace, under the leadership of Mayor Sylvester Turner and also Director Stephen Williams, is to provide a comprehensive healthcare approach so that our youth ages between 10 and 24 can have a level, equitable playing field so that they can be successful, not only in their entrepreneurship or educational goals, but also in everyday living. So I just wanted to mention that regarding Houston Peace. You can still visit that website, which is Houston4peace.org. I will still be connected to the coalition because the work that I do perfectly aligns with the goals and the missions of the coalition. I know that they'll probably be announcing someone who will be filling my role rather soon. I'm not too sure, but I do want to make mention of Houston Peace and the work that the Houston Health Department is doing for violence prevention, because it is great work and it is focusing on making sure that our youth are preventing violence, promoting health, and providing opportunities. My new role that I started about a week ago is the executive director of the Forgotten Third. I want to provide a little information regarding the Forgotten Third. Every year we hear that 2 out of 3 individuals recidivate within their first 3 years of being released from prison. They're either violating their probation or parole, or they're catching new offenses. 2 out of 3, 66 2/3%. What we don't hear about is the 1 out of 3 that get out, that stay out, that become successful. Thus, they are the forgotten third. They are credible messengers. These are the ones who have gone through the system, successfully reintegrated back into the community, and have overcome the various barriers that prevent them from becoming successful. They are the forgotten third. I am a forgotten third. At the age of 7, I shot my first gun. This is why firearm and gun violence prevention is very important to me. A little bit about my background: born and raised on the south side of Chicago, former drug dealer, gang member, sentenced to prison at the age of 18 for 4 years, selling controlled substance, carrying a firearm. No desire to change, released from prison after serving 1 year, right back to selling drugs, carrying guns, illegal activity. At the age of 19, I was sentenced to 18 years in prison. It was the second time that I was in prison. Light bulb came on, talking to other individuals about making positive change. Went to Illinois Valley Community College, received my associate's degree while I was in there, dropped my gang affiliation, shifted the paradigm of my thinking, and ultimately my 18-year prison sentence was reduced in half to 9 years, and I've now been out of prison over 22 years. And so the difference of me staying out of prison the first time of 1 year and 22 times is a formula that I learned. So repeat this after me. Say information. Come on, a little more energy. Say information. Plus application. Equals transformation. So let me show you really quick how this formula works, and I'm going to tell you how the program works. Think of a number. Don't tell your neighbor what the number is. Make it a small number. Don't make it too big. We're going to do a little math. I want you to take that number. I want you to multiply it by 2. Multiply it by 2. It's our first time talking. Give them a number to add. Not too big, and make it an even number. Make it easy for them.
4.
4. You say add 4. Think of a number, multiply it by 2, add 4. Now what I want you to do is take that number and divide it in half. Think of a number, multiply it by 2, add 4. Now you're going to divide it by 2 or cut it in half. Very last step. Take the number that you originally thought of from what you have right now. Everyone in this room have 2. If you don't have 2, stand up. So the way the formula works is like this. I found out what transformational change meant and how to operate it, and how to work the formula, and that changed the outcome of my life. And so thus I've been out now over 22 years. The formula works if you work it. It doesn't matter where you start, the outcome will be the same. Everyone in here started with a different number when you started out with, but when you work the formula, everyone came up with the outcome of 2. I'm now overseeing a program in partnership with the Harris County Juvenile Probation Department. I'm running a program at Harris County Leadership Academy, and this is a credible messenger facility-based program where they're in the program either 6 months or 3 months, depending upon which program they're in Leadership Academy. Through this program, they will get holistic cognitive behavior therapy treatment, me talking to them using the iceberg model, talking about the 25 sessions of the majority of the things that our youth are dealing with are beneath the surface, their thoughts, their feelings, their emotions. providing them with mentors while they're in there, connecting them to mentors prior to them getting out, and connecting them to community-based organizations that can provide the successful wraparound services for them upon release. So connecting them with a mentor while they're in there and connecting them with a mentor prior before they get out, and to an organization that can help them with job readiness, mental health. Someone talked about trauma-informed care earlier. These type of successful services that our youth need to become successful. And these are the youth that we're working with, chronically involved in the justice system. They're disconnected from positive supports. They are believed to be beyond the reach of traditional social service. They're resistant to change. They're gang involved. They're categorized as high risk, and they're involved in gun violence. All of those characteristics I can identify with. I was all of them. But I learned how to work the formula. And so through the Forgotten Third, we're working with our youth in the justice system, teaching them how to work the formula. The formula work if you work it. I have a young man here that I've been working with for over 6 years. I was only supposed to work with him for 6 months, but I've been working with him for over 6 years. He's not recidivated. He's not caught a new case. He's no longer gang involved. He's now working as a credible messenger. He's currently authoring a book 6 years later. So it'll work if we work it. If we want to stop gun violence on the front end, we have to do the primary prevention, and that may include us intervening while our youth are involved in the justice system, because reentry begins on day one of incarceration. We start while they're in there, and there's a continuum of services for them once they're released back into the community. That way we reduce gun violence, one life at a time, one family at a time, one community at a time. Thank you.
All right. Doing okay on time? Okay. Our next speaker is going to be Crystal Okorafor. And she is the Deputy Inspector General for the City of Houston's newly created Office of Policing Reform and Accountability. Appointed by Mayor Turner, she is the first to hold this position, and it will be investigating complaints and working closely with the Independent Police Oversight Board to restore trust in the police among Houston's many diverse communities and to provide greater transparency for citizens.
Thank you. Wow, you were really great, Carlton. That was awesome. Thank you guys so much for having me. I really appreciate it. My name is Crystal Okorafor, and overseeing the Office of Policing Reform and Accountability, I also now oversee Mayor Turner's new violence prevention plan, which is the One Safe Houston. And as we've spoken at great length today from all of the speakers, there's not one way to stop violence. It's got to be a comprehensive approach that takes into so many different factors. It can't just be the police department. It can't just be, getting guns off the streets. It's got to be giving people the mental health services they need. It's got to be looking at domestic violence. It's got to be so many different ways to facilitate it. And so Mayor Turner's plan initially started out with, nope, that didn't change it. There. It started out with $44 million of ARPA federal funding, and it is now increased because of the success of the program since it was announced on February 2nd to over $53 million. And of that money, you can see that the majority of the funding is going towards crisis intervention, response, and recovery. It's taking approximately 70% of the funding of the $53 million. $10 million of the dollars are going towards the police enhancements and overtime for patrol, for additional officers to make up for the shortage of officers that we have in Houston. We're additionally hiring more people in the Parks Department for park rangers. There is a gun buyback program that's going to be happening later this summer with Commissioner Ellis and Mayor Turner. The Houston Forensic Science Center is getting $3 million to help with the backlog of the criminal justice system. They are getting money for overtime to get the cases so that they can do the research and do the testing that's needed so that when those cases go before a jury to go to trial, prosecutors aren't waiting on those to be, for the testing to be done. They're also getting additional equipment. There's also going to be $3 million going to the Houston Health Department, and you're going to hear more information about that from our next speaker, in relation to the community violence interruptions, credible messengers, and then also another $1 million for the reentry program, which helps individuals that have been through the criminal justice system, as Carlton was talking about. And then there's $9 million for domestic violence. And that is super key because we've talked about how domestic violence has gone up significantly since the pandemic, and we've seen it increase over the years, not even pre-COVID times. Since 2020, from 2020 to 2021, there was a 50% increase in homicides among domestic violence. And so the mayor has given this almost $10 million so that we have 24/7 domestic violence response teams. They come out and they have caseworkers and people that have been trained to handle these cases. It is a specific group of officers that have additional training. They're also helping out with emergency shelters for these, not women, for individuals that have been victims of domestic violence. They, so far this year, have gone out to over 1,000 scenes, and they've assisted with 500 individuals getting emergency shelter. And part of that $9.6 million is to help with the shelter crisis that we have here in Houston. We only have approximately 200 beds for all the millions of people that are here in the city of Houston. And so now HPD is able to, out of the ARPA funding, give those individuals housing. So if you don't have somewhere to go, and we all know that those 72 hours after something like this happens and someone's arrested are the most dangerous times for those individuals. And so now we can get them out of the home, and if there's not a place to go at Hawks or some of the other shelters, we can put them in a hotel that's got that individualized training so that they know not to give out somebody's personal information and things like that. And it's critical that we have these resources. And COVID has brought a lot of horrible things, but this additional funding so that we can fund so many programs that are needed for our city, it's just really been impactful. Of those 1,000 plus scenes, there are over 600 children that were at those scenes. And that's a staggering number because we talked about what is happening to the trauma that the children are seeing. And so we're able to get them the information and get them resources that they need also. And then we've done forensic exams. Part of that funding is so that if there is a situation where they arrive at a scene and a forensic exam needs to be done, they're going to be able to, at a later date, do those exams at the scene versus having to bring someone to a hospital where they then are going to have to find childcare and all these other things. And so they're stopping what could be a hindrance so that we can get the resources that they need at the scene. And then also we have a ton of money going towards mental health initiatives. This is major because it might not solve things, but this is a critical part to making our city better and safer. And so I'm going to go into those key wins we've seen since the initiation of the program. So we have had 125 officers since February 2nd when the mayor announced it. Since then, they have done just those 125, not the entire police department. They have executed 700 felony arrests. They have recovered over 500 guns, and they've also recovered 312 automobiles. Last year alone, there were 36,000 guns stolen out of from individuals in our city, and that's just what's reported, right? So how many guns were really taken in Houston last year? It's probably not, it's a very high number. And so that is why we're having that gun buyback program, so that if you have a gun, and no one's saying get rid of your guns, but if you want to get rid of your gun, we have a place where you can go, and it's going to be an anonymous gun buyback program. So we're not asking for your ID. There'll be no information taken from anyone as far as what's going on, where the gun came from. We're just going to take the gun and we'll give you funds for that. Additionally, with the mental health crisis intervention, the almost $23 million, that's gone towards 3 different programs. First off, we have the CERT teams. The CERT teams are a grouping of teams with an officer and a mental health clinician, and they arrive on the scene to help out in situations where they need police, but they also need that mental health services. From the first quarter of the year, they have gone out to 600 calls, and of those 600 calls, I think it's important to note that they only made 1 arrest. 600 scenes, 1 arrest, because they are taking and trying to figure out what that person needs and de-escalating situations and not just putting people back into the prison system. And then we have, they've also helped with emergency mental health medical orders, and so they've gotten done over 120 of those in the first quarter. We also have the MCOT teams, and there's 20 CERT teams, and so they're working around the clock. And then there's 18 MCOT teams, and these are teams where they're going out to a scene and it's just a clinician or a mental health person. There's no police involvement whatsoever. So if someone is having a mental health episode or whatever and it's safe where we don't need to have police intervention, they are going out to those scenes. And of those, so far in the first quarter, they have diverted 766 calls away from the Houston Police Department and 347 away from the Houston Fire Department. So that's approximately almost 1,000 calls when the fire department and the police aren't even coming to those mental health scenes so that they can go to our high priority situations that are so critical at this time. Another thing that we've done is the Cadillac converter ordinance. We were all stunned to hear about the deputy that was killed when they came outside about their Cadillac, while their Cadillac converter was being stolen. This is not something new. It's something that is tragic that's happening around the country. And so what we've done is we've made it where you have to show proof of ownership in order to sell a Cadillac converter in the city of Houston. And so that is going to hopefully eliminate some of the thefts. And because our ordinance that we've drafted is so great, I mean, we're amazing. But the state is looking at trying to pass legislation that mimics what we've done here in the city of Houston, because we are breaking ground and making important changes that are needed. Another thing that we've passed here since February 2nd is the camera ordinance. The camera ordinance is requiring in nightclubs, sexual-oriented businesses, convenience stores, and game rooms to have outward-facing cameras that show their entrances and exits. We've all seen that technology plays an important role in the police department. They were able to find the shooter from the Galleria because of all the cameras that they have in that Galleria area. And so this camera ordinance is going to make it so that if there is a situation that takes place outside of a convenience store and HPD responds to that scene, the owner of that business has to provide that surveillance video to the police department within 72 hours of a request. They're also going to have to hold on to that information and to store it for 30 days from any time. So they'll have to hold that video so that the police department can get to it. Also, there was 15 additional park rangers that are going to be hired. Of those, so far, we've got 3 underway. And then we've got the community reentry program that Ms. Latasha is going to talk about soon. But they have a graduation this week, and they have expanded their program because of the success that it has seen with kind of really taking a person as a whole and giving them all the resources they need, not just like a business card and like call this number. They are really a wraparound service. And so, although homicide is increased with COVID, and we've seen it, we have seen a decrease since the beginning of the One Safe Houston program. So on the slide, you'll see that in 2020, we started out at 28 homicides for the city of Houston as of February 2nd. That number has increased from 37 in 2021 to 48 in 2022. And that's when Mayor Turner announced it. So it was a 30% increase from 2022 to 2021 in February of this year. As of June 1st of this year, since we've implemented these programs, we are at a negative 2% from last year. I am excited about the decrease in numbers. Unfortunately, 1 death is too many, and we're still above where we were in 2020, but we're at least trending in the right direction, and I think it's important to look at that. And not only are the homicides rate decreasing because of what the police department's doing and what we're doing as a whole within the One Safe Houston, we've also seen a decrease in all of the violent crime categories. The robberies were down 14%. Sexual assaults were down 33%, and aggravated assaults are down 9%. And so we're excited about the trend, and we hope that we continue to see it going down as we initiate more of these initiatives. For more information, please go to the website here at www.houstontx.gov/OneSafeHouston. We update it constantly with information about resources, funding, how things are being implemented. And this One Safe Houston is getting a lot of important publicity. In fact, the President Biden's President Biden's administration has been super excited about it, and Mayor Turner and Chief Finner were there about a month ago, maybe 2 now, to talk about how this ARPA funding is being used to help with the funding, help decrease crime here in public safety. And so please visit the website for additional information as it comes out. Thank you.
All right, thank you so much. Our next speaker is Latasha Selexman. Great, all right, who is the Director of the City of Houston Community Reentry Network Program and the MBK Redirect Program. Her role is to provide oversight and direction for both initiatives by promoting public health and safety for individuals and families who have been impacted by the criminal justice system.
All right, good afternoon, everybody. I am so excited about everything that everybody's doing to prevent and reduce gun violence here in the Houston area. Oh, wrong way. Okay, that's me. So just a minute here, I want to talk about the mission of the Houston Health Department and really what we do with the community. We really partner and work with individuals and the community to promote and protect the health and well-being of Houstonians. So what we're doing now is to do the same kind of work as it relates to gun violence. Let me make sure I press the, I did it, okay. Okay, so our mission is to prevent, disrupt, and stop the spread of violence by implementing the following evidence-informed programs. So some of them are evidence-informed. We've also heard that they are evidence-producing, and some of them are evidence-based programs. So there are three. We have CVI, we have credible messengers, and we also have the reentry program. So the first one I want to talk about is CVI, and that stands for the Community Violence Interruption Program. I get it kind of mixed up sometimes. Sometimes I say intervention, but interruption is correct. So that's the first initiative or strategy they were going to implement. With the Community Violence Interruption Program, it's the immediate response. So whenever there is a conflict, you have people who at some point are involved in violent activities. We want to get in there with the community. We're going to make sure that we engage community-based organizations who are going to hire individuals. You've probably heard them call today credible messengers. You've heard them call violence interrupters, same kind of individuals. And they actually get in there in the mix. They know the people in the communities who are the perpetrators and who are the victims, and they're going to stop the violence from actually occurring. They are out there in the streets. They know what's going on. We're going to engage with those individuals. They're going to provide the supports. They're going to provide the engagement. They're going to prevent the violent activities from happening. So that's the first group that we're going to engage with. We see these people as the people who have their ear to the street. So once they stop the violence from happening, they are also key in stopping the retaliation from happening. We see violence on the continuum. Once we move them from the community violence interruption group, we're going to also engage the community with credible messengers. So those credible messengers will be the mentors, and primarily what we see is this gun violence or this violent activity happening with older, what I call young adults, because they're still younger than me, right? So they're around 24 to 27, 30 years old. Those are young men within that age group where we really see this happening. And the credible messengers that we have, they're also trusted individuals who are a part of these community-based organizations. The City of Houston is actually, we're running our programs parallel with Harris County. And the community-based organizations that we're going to be engaging with, they're going to hire these credible messengers and the violence interrupters that are already out there in the community who are doing this work currently. These credible messengers are trusted individuals who work in the community, who've been doing this work, who know already the people in the community who have engage with the individuals who are at highest risk for violence, who are perpetrators, and who have also been victims of these crimes, right? So the credible messengers are trusted to go out there and really get the people the supports that they need, and not just the individuals. The one thing that we recognize is also that their families are in need of some kinds of support, be it basic needs, be it housing, be it workforce development. One of the things that we realize in working with individuals is that a lot of times they would not be engaged in these kinds of activities, but for the fact they don't have access to many of the resources, or they live in these under-resourced communities. They don't have the access to health care. They don't have the access to workforce that would be readily available in some of the other communities that they just don't live in, right? And so we want to provide these kinds of resources within the communities that they live in. The last program that we're implementing as a part of the public health response is going to be an expansion of our current Community Reentry Network program. So right now, one of the things that Crystal mentioned was about our reentry program. We're having a graduation on Thursday. If you'd like to come, you feel free to contact me. But as a part of our reentry program, right now we service about 500, or provide supports for about 500 individuals annually. And a large part of it is due to our staffing. Of course, with staffing, you have a limited capacity, but with the expansion in reentry, we're going to be able to serve about a 50% increase on that number. So, like I said before, we see violence in the continuum. We see young people, and then primarily an older cohort of people between the age of about 24 to about 30 really perpetrating the violence in this area. And so, you know, the younger people are really watching that older cohort and what they're doing. They're becoming engaged. They're following along that continuum with these older people, from what I've seen in working with this redirect group, who's really, it's a diversionary program. But as they follow along with this older group that I'm working with, the reentry gentlemen who I engage with that are much older, many of them have spent time in prison 10, 20, 30, 40, 50 years, even longer than I've been alive, right? And they come out and they say, I see a young man who looks just like I did before I went in. And I don't want them to follow down the same path. And so what can I do to help this young man not follow down the same path, not become a victim or a perpetrator of gun violence? What can I do? This is why I said it's a continuum. And so as a part of what we do, we want to prevent these individuals from following down that same path. We get them involved with those community-based organizations that are currently doing the work, and we get in there, we figure out what are those things that they need as a part of the reentry program, where there are a few things that we've identified that they need. Number one, they need the basic needs kinds of supports, those Maslow's hierarchy of needs. If people don't have those basic needs supported, you're not going to be able to tell them about jobs. You're not going to be able to tell them anything else, because they're going to need food. That's the ultimate thing that they need initially, right? The next thing that they say that they need is a job, of course, right? If you have food, then of course you want a job then. So then we're going to help them with workforce development. I think I have that up there. So then after they have that, of course, housing. That's one of the basic needs that people have. People need stable housing. And then the other thing that they need is access to care. As a part of access to care, stable, basic mental health services is it. I know that there was some talk about it a little bit earlier about mental health and how it relates to gun violence. Well, I'll tell you this. One of the things that we find as a part of our program, about 30 to 35% of the people leaving the Texas Department of Criminal Justice have a diagnosed behavioral health condition, and that's diagnosed. Many people leaving incarceration have an undiagnosed behavioral health condition. It is nothing more than PTSD. And so we really want to be able to provide more people an opportunity to be assessed. As a part of our program, a large part of what we do is an assessment. And so we want to make sure that people are able to get access to care. As a part of the health department, of course, what we want to do is make sure that people have access to good health care. So I want to go back just a little bit and let you know that with this program, as what we're doing with One Safe Houston is really looking at a public health approach to all of these strategies that we're going to implement through public health for individuals who are engaged in gun violence. So let me go forward just a little bit here. So how do we get to this point? So we got here and really decided how will we implement this? So could we use the money that we've been allocated? Crystal talked about the funding that we've been allocated to do the work that we have here. Will it spread and cover the whole city of Houston? Well, probably not. So we have to start somewhere, right? So what we did, we looked at, Dr. Hafiz, I believe, talked about SVI. And we looked at actually SVI, and we looked at CCVI as well, and we also looked at the high rates of gun violence. And so as we looked at that, we looked at low COVID vaccination rates, we looked at high COVID people with high COVID rates, right? People who really, areas where they had people who were really infected with COVID high. And so what we found was that people in a certain age group that we were really priority areas, we looked at that, and we found was that we really should target the northeast quadrant of Houston to start this priority target area to start the program off. And so that's where we're going to start the program for the first 12 months of the project to show proof of how the program is going. And then what we're going to do is move forward from there. And I'll tell you that the reentry program, as she said, that part of it, it's already been started. It's already throughout the greater Houston area. But we'll continue to focus the new initiative, CVI, Incredible Messengers, on the northern side of Houston. And so we'll be able to really look at the results from there and really grow and build what we're implementing from there so that we can show results in how the strategies that we are implementing as a part of the One Safe Houston public health strategies are building on the work that we're doing. I have to say that we have really partnered across the country and looking at the cities that have already implemented this work in other areas. And it's been really interesting. In Austin, they've done some work. We've looked at Minneapolis, we've looked at Dallas, we've looked at a number of areas. We're fortunate to be able to really partner and work parallel with Harris County and the work that they're doing. And we're grateful to have been able to learn, to gather many lessons learned, really partner with national experts in this area to really get some guidance and some traction on the direction that we want to go and the work that we're going to do. And with all of this information that we've gained, we really believe that the work we're going to do in Incredible Messengers and also CVI will really help us reduce gun violence using a public health approach. All right, thank you.
Okay, our last presenter before we have our Q&A session is Victor Gonzalez, who is the Division Manager of the Mayor's Office of Gang Prevention and Intervention for the City of Houston. Since 1994, the Mayor's Anti-Gang Office, renamed the Mayor's Office of Gang Prevention and Intervention, has worked to provide comprehensive responses to youth violence, juvenile delinquency through direct services, collaboration, education, and policy development.
Good afternoon. Happy to be here. It's always nice to come back to Rice University every now and then. I'm not in academia. I'm from the streets. That's where I grew up. That's how I learned to do this work. I'm a product of some of the things that everybody's been talking about. I've been doing this about 37 years. I was calculating in the back because I'm listening to things and I'm like, man, you're getting old. I turned 56 this year. And when I've watched and listened to things that are going on in our city, I've been in the office now 23 and a half years. Worked a nonprofit. Got in touch with the mayor's anti-gang office when Adrian Garcia and Kim Ogg were there. And I knew Adrian from the streets. He was a cop. He was in the clubs that I used to monitor and deal with extracurricular activities. So I knew Adrian, and I knew a lot of what was going on. And by nature of my background, I just didn't trust police, and they didn't trust me, and I didn't like them, and they didn't like me in the 90s. We didn't get along. I'm dealing with kids that they're trying to arrest, and I'm trying to help those kids find another way to live. And it's not always easy when you're doing this work. This is lonely work. Sometimes it's only cater to a few people that can put up with the stress. You know, Doc, doing how you do and dealing the stuff that you deal with, you know, my hat's off to you being so young. I'm looking at you, I'm like, this young lady doing what she does, and it's passion. It's passion, it's compassion, it's love of what you do. I've been doing this so long. My wife says, when are you gonna retire? And I said, I don't know. I have a consulting business on the side. I do a lot with the National Gang Center, OJJDP, BJA at DC. So I do a lot of work on the national level providing TA about gang outreach work. That's my niche. Violence interrupters, credible messengers. I've heard those names for a long time, and people have tried to come in to Houston and pitch it, and now it's here. And the biggest thing I can say to you new programs that are out there on the grind like we've been for all those years is that let's continue to work together in Houston. That's all I've tried to do since I've been there, is to bring people together that want to help this population, but also we need to have some accountability in place. I think sometimes when I was doing this work early on, the word from the police was, that's the hug-a-thug dude. You know, he hugging thugs, and he's not going to do nothing but protect them. He's not going to do anything to help us on this end. When they really didn't understand, I'm trying to create quiet and peace on the streets too. I just do it different. I have conversations with OGs. I have conversations with old guys that I can get to that you can't. And sometimes your approach with kids isn't always the best, and sometimes we have to change our approach, our tone. Not to say that we let them get away with stuff and turn a blind eye to stuff, especially when we're talking about safety. In our city, it's one of the biggest things I look at, not only for the kids we deal with, but my staff. I've got several staff that have been with me a long time. I'm transitioning now. My 12, 13-year guys are moving up or moving on, and so I'm in a transition. I've been talking to health about some programming that we're going to be doing. Housing just provided us some additional money to add some additional bodies. Lupe and I go way back to the gang supervision, enhanced gang supervision program that we started with probation back in 1999. We still have that program going on today. It's called something different, but we've had a lot of history here. And in Houston, I wanted to be able to give you a better idea, a little insight on the office. You know, we're here to help the families, the community, the schools, the kids, the people that live in the projects. I'm an apartment kid, apartment complex. I'm a food stamp kid. Government cheese, best cheese ever. I don't care what anybody says. Government cheese you can put on anything. Bread, tortilla, toast, drop it on a piece of Spam, it's good. That's the kid I am. Those are the types of kids we're reaching out to. Those are the types of kids that we're dealing with, the families that are struggling. But I had to learn over the years that being in our office, I was going to have to bridge gaps between agencies that probably didn't agree with my approach or didn't agree with my vision. And it was trying to sell a gang member that can be somebody different. It's like selling a TV to somebody that's doesn't have a backside on the remote, and it's got tape all over the remote, and we don't have no knob on it, but I want $200 for it. It works. And a person will be like, man, I just go to Walmart, buy me one for $3, and it's gonna be nice. I'm gonna have Wi-Fi and everything else on it. Talking about gang members is not always something that people want to hear. You hear gang member, you hear murderer, you hear thief, you hear robber, you hear somebody that's not very well liked in the community for the things that they do. It happens, it is what it is, it's crime. I'm not okay with it. I don't like the violence. The kids know it, the adults know it. Everybody that knows me know I'm not with that violence on the street, especially when it comes to guns. Because nowadays guns are not being carried like we carry IDs. We're beefing over social media beefs. We're beefing over disrespect. We're beefing over girls, over guys. I mean, we're beefing over stuff that I'm like, well, how did it get to this point? Where I have to look at the criminal justice agencies, our DA's office, all the stuff that I hear with bond reform, everything that's going on in our city right now. It's time to wake up and really talk about bridging gaps. Like I've had to bridge gaps with agencies who now trust us. I'm on the right side of the fence. I'm not trying to hide. I'm out here trying to do the best I can with a difficult population that takes time to work. It's not just going to change over a matter of months. It never does. Through our strategy, services, and collaborations, the goal is to reduce violence. I follow the comprehensive gang model. I'm a gang outreach specialist, gang intervention specialist by trade. That's what we call us. We've done violence intervention. We are that messenger in the street that people trust when we've established ourselves in certain areas of the city. I only work in certain parts of the city because I only have so many people to do gang intervention and prevention with individual members, multidisciplinary partnerships, Again, we've got to share some information, some client accountability. We've got to be able to talk with one another, because what I've learned doing this work is we share a lot of people in this work, and we overlap services. When I was listening to you talk, Doc, I was thinking of a kid, Luis Delgado, who came out, and the ugliest part of my job is to hear a mother crying when her son's dying in her arms. And it was a kid I took to Benton. We got him a job. He got hit by a car on his first day, right off the bus. They hit him off the city bus, Metro. I go pick him up at the car wash. A week later, he gets killed. And the mother is calling me at 2 in the morning. We're on the phone, and somebody kicked the door and popped him in the head. And you could hear him gurgling and blood, and she's describing, and I'm trying to coach her the best way I can, like I've done many times with kids who have injuries, with the homies calling, what do I do? And at the end of the day, it was the ugliest thing to have to hear that boy die on that phone. And that mother lost it. She lost it. And so then I go to Benton, and I got to see the boy. Wrapped up, tubed up, as we say with the kids. But it's a thing that you have to understand. The work is so difficult. I have several people. I have my horses. I call them my horses, my gang violence reduction team. They're my senior staff. They're the ones that are in the middle of the trenches with the most active gangs that we end up dealing with in our city. Like I mentioned, I'm only in certain sides of the city. I'm not everywhere. I'm where the gang crime is. If you want to reduce crime, you've got to go where it is. If you want to deal with the kids that are involved in the crime, you got to go where they are. You've got to tap into the gangs. You've got to know the signs. You've got to know what it is. You've got to know what that means. When you're working with them and they're conversating with you, what is it that they're saying to you that sometimes they can't say in language that we all understand? We are different people. So my horses, my gang violence reduction team, they're the ones that are the frontline workers dealing with that population. My early intervention, they're my rookies. They're my babies. They're coming up. They work with my middle school kids. And every now and then an elementary school kid like we had the other day, we call the school to come visit, and they said, please take him home. And this kid's like in the 3rd or 4th grade. I mean, he hell on wheels. The kid knows a little bit about gangs. He mimics gang signs. He don't know what he's doing, but he's already picked it up. And he's already displaying that stuff, and he's turning the school upside down. So my staff gets out there, my Southside Gang Violence Support Project, I only had one person on that. COVID has kind of killed it. We've done what we can here to close out the grant that's gonna finish out in October. But they're doing case management, incident response and mediation, gang violence reduction teams. We have 4 meetings in the city where I have people that are working with kids in those different areas of the city, and we are talking about, it's for lack of a better term, staffing. It's a staffing. We're trying to find the resources that they need, get them those resources. If there's challenges or barriers to the agencies that we're working with, we try to find ways to break those. Where are the loopholes? Where do we need to do to help this kid gain access, this family to gain access to services? I have a lot of folks that support us, that help us at the drop of a dime with drug treatment, vocational trade, job, tattoo removal, anything that these kids are going to need. I've been around long enough to be able to have some resources in place, but I'm going to tell you now, if you're just getting in it, you're going to do a lot of maintenance, because we had a lot of turnover here in Houston when it comes to different things that are going on with agencies. Public awareness, if you need training, I don't care if it's 2 or 3 people, you've got a group of professionals that want training on Houston gangs, how to deal with gangs, let us know, give us a call, we can help with that. We do a lot for schools. We go a lot to schools and talk to kids, some in small classrooms and some in big auditoriums, just depends on the school. Prevention, COVID has kind of hurt that for us, but it's starting to pick back up. After school programs, alternative activities, we started to do something about 2 years ago with the Dynamo, MLS, and we picked Jane Long as a pilot in Southwest Houston, where the Cholos and MS are a big recruiting ground for those 2 gangs. And we started doing 5 weeks of soccer with the kids after school. Our busiest day was damn near 70 kids. And then after that, we had a low average, maybe 35, but now Jane Long has picked it up and kept it running. That spun off Sugar Grove. Sugar Grove wanted to get involved. We got Sugar Grove involved. We did that over there. Numbers stuck around 50. And we're going to be building that project with an after-school program that's very consistent. When you get into the non-civilian employees, we're looking at a social case work management model. We're looking at linking them, a lot of hand-holding in the beginning. I'm not going to give you that here, go find it, go get it. I don't work that way. I ain't like that. We're going to walk you through it. It's mandatory, my staff. You walk them through it, get them comfortable, introduce them, let them know who it is. If I need to go lay groundwork down before you get over there so you as a staff feel comfortable, let me know and I'll lay the groundwork so that people know what to expect when our clients come through. Because our clients are tatted up. I've had guys with tatted all over their face and their head, all over their body, and people are not always okay with that. They get scared. They get a little intimidated. And so we have to be able to work through those things when we're dealing with our different agencies. Home visits and school visits, even in the detention center if we need to, down at Congress or any one of the other youth village or leadership out in Katy, we'll get out there and meet with them. Got to have the families. Families got to buy in. You got to get with the families, and they don't trust. It takes a lot of work to get them to understand what you're about. We are city government, so sometimes we're the police, y'all undercover. You can call that all you want. Then I start talking that gang stuff, and they go, okay, you're not the police. You're not the police by any means. You know what's up. You start talking about the gang dynamics on the streets, hearing what's happening, just enough to get them to understand, we understand your situation, we understand your child, we're different. We're here to help you, but we got to have your support. Conflict resolutions, mediations, we get in the middle of all kinds of things, from shootings in the streets to a beef on a campus. Real simple, real quick, knock it out and get it done. This is just a little bit of what we probably on an average you would see with this. 600 referrals that come through. We may not meet them all because some come, they want information, they don't want to follow through, they move around. We might open up 500 case managed clients, 50 gang related incident responses. That'll vary. We average about 100 gang awareness presentations. Anywhere from 8,000 or 9,000 kids to 4,000 or 5,000 adults, doing all kinds of training for citizens in the community. We've done HOAs, civic associations, you name it, we've done it. I've done churches, anything in any agency or anybody that wants to learn, we're there to teach you. If you want to learn this stuff, even if you want to do something virtual, we can do it virtual. COVID forced us to go where we had to go. You're talking about 20,000 gang members, they say, in the city. I think it's a lot more than that. When you look at our cliques, it still meets the definition of what a gang is. The younger population is picking up these guns like sometimes I eat a Snickers bar. I mean, it's just so common. To be on social media, posting it, and getting that satisfaction when you talk to them, they say, man, they know not to mess with me, Vic. They know I'm protected. They know I'm not going to play. Their self-esteem, the power that they feel holding that gun, the way they carry themselves with such confidence when they have a gun in their hand. But when you get them behind the scenes and that gun ain't there, and you dig a little deep about what's really going on in their lives, their heart's broken. It's broken, it's lost, it's confused, they hurt, there's a lot of pain, and they don't know how to deal with it other than to act out and be angry. And now they got guns in their hands, and now we're shooting people like it's no big deal. I'm here I just took over the office to close. I just took over the office roughly almost a year. And so I've been trying to wrap my head around that, getting from the streets to the administrative level at another level. But I'm here to partner with anybody that can fit in our role strategically as a city, because I believe that the quicker we get to situations on the front end, or in a situation where we have something at a hospital where the gang's following to make sure the person's dead, they're watching, they're sending people in, they're trying to get a real name, you got to go John Doe, you got to change it up, to the funeral services. So much goes on with this that it takes a lot of collaboration from a lot of people. Do not hesitate to reach out to our office. I'm here to conversate with you, listen to you. It's the one thing that I've learned, that a long time ago when I was young, I'm going to do this, I'm going to die doing this, and I don't care what anybody says, I'll do it myself. But I've learned with age, you got to work smarter, and not harder. And people are good people. When you latch on to good people, good work gets done. So kudos to the county, to the city where we're moving. It's just additional work. That's going to help me free my staff up to concentrate on other areas that I've needed to. But to everybody that was here today, I appreciate you coming. And for the folks that coordinated this, I really thank you for inviting our office. We're a true partner if you ever need anything. Thank you.
Could I actually invite all of the presenters for the community violence programs to come back up? I'm going to stay standing with Dr. Nayak.
That was amazing. Wow. I'm so inspired by you all. So we have a few cards, and we'll walk around and take more cards, and we have about 15 minutes of questions. This is a great group of people here doing a lot of excellent work. Please feel free to ask questions. If you'd like, you could, when we're done with the cards and you don't feel like writing a card and you think of a last-minute question, it's okay to raise your hand. As long as we have time, we'll try to get to you. Okay, so question number 1, how can we better collaborate between groups to truly leverage and scale up all of these efforts, such as trauma centers and these community programs? I had a very similar question. It's great that we're starting a HVIP with Ben Taub, and I hope we include my colleagues here. That would be awesome. But there's a lot of other hospitals as well in Houston and other trauma centers, and there's so much great work that's going on. Us working in the hospitals, we feel very siloed. We don't get to interact with the community, and it's so important to have that interaction. So how can we better leverage those the work that you all are doing? Anyone?
I think it starts with having those small conversations. I mean, what are the needs? I mean, you've heard from several different people today, and you've learned about some new programming. And usually what happens in these situations, that leads to another conversation, that leads to some more programming that you weren't aware of. I think a lot of times it's educating ourselves on all the programs that we have in our city and in our county. A resource inventory, I guess is probably the best way to say it, is what is out there that maybe could latch on to something that you have, even if it's a small idea. But I think it starts with a small conversation of what needs you have, and then what people can we bring to the table that can maybe stretch out the services that they have. Because I know I've wanted to work with Ben Taub for a long time, but I'll admit it's time for me. And really finding the right person, because every time I thought I found somebody was being moved around. So for me, it was, well, you show up when you show up with a client, because that's usually when it happens. But for us, it would be a small conversation. It would be the needs. I tell you what I have, how I can support, and then we'd be realistic about what we can do to get started with something small that eventually will grow, and then look at the funding opportunities, because that's going to be, if it goes well, you're going to need money. You're going to need money and bodies to put it in place.
And I'd like to add, when we have challenges like this, or we have initiatives like this, we do something called asset mapping. We know, or we have figured out what's in the community, and figuring that out, we identify the kinds of assets that are already in the community, and we pool the resources that we have together. So one of the things that I mentioned was that we're running our program, our violence intervention program, parallel to what Harris County has. So we identify what's already out in the community, because we don't ever want to run any program in the community without the community having a say. It makes it less effective if we are not aware of what the community wants, and let them really guide the work that we're going to do. And so we really want to get out there and just complement what the community already has going on, and really provide them the undergirding in the work that they do. We're just kind of we're just the undergirding, and just working together, the city and the county and whatever other entities we are able to bring in as a resource. That's just kind of how I think we work best in what we do.
And I think it's important to, like Latasha and Victor both said, to know what everybody's doing, because there are only a certain amount of dollars going around, only a certain amount of staff. And like we mentioned, we're working in partnership with the City of Houston so that we're being good stewards of the dollars that are being given to the programs, and we're not overlapping, we're not duplicating service areas, and we're not duplicating the services. But we're working together, and we're in constant communication. We're in meetings very frequently. And another part is we're going to measure the programs. You know, especially Harris County is a performance-based county, performance-based budget county. And so we're going to have to demonstrate that what we're doing is working. So from day one, we're collecting our data. And one of the great things that we've done with the city is we're saying, okay, what are y'all measuring? What are you looking at? You know, so that we can partner and we can, you know, look at the same things to show the impact, not just your outcome measures, but what impact are we really having in our community? And it does involve speaking to the community. I was like, we've been having community engagement meetings since early January. And I'll tell you, some of them have been heated. And they tell us, well, y'all are coming in and we've had so many programs come in and they come and go. And we're having to take a step back and explain, like, okay, well, we're not a grant-funded program. We're here to listen, and we want to hear from you on what direction we need to take with our programs. And the other thing I failed to mention during my presentation was that another initiative that the Harris County Public Health Department is launching is Access Harris. That is a coordinated care system where any of the residents that are going to be involved in my program, if they have compounding issues, we are working with all the safety net agencies in Houston and Harris County, that all of those safety net partners can have access to one dashboard for that resident. So if they're on probation or they're getting mental health services, people know what's happening with that one resident. Because many times, as a former juvenile probation officer for over 20 years, we set families up for failure because we have all these expectations. Oh, you have this many meetings, but you have a mental health appointment, but you have a drug treatment program, and you got to go see your PO. Oh, you missed your appointment, all the whys. But if everybody's working together and looking at one dashboard for this care coordination plan, I think that's going to be successful. So we're really excited about getting that going as well.
And lastly, if I can add, I like what Latasha said, and I often say this, that when we're doing programming in communities, we have to realize that the community does not need a seat at the table. We must realize that the community is the table, right? And so once you realize the community is the table and we're going to serve them as public servants, then our priorities are in order. Oftentimes, what I see with the conflict and collaboration is roles and responsibilities are not clearly defined when you're cross-pollinating with other organizations and agencies, whether they be government entities or community-based organizations. And I think the main thing is the focus has to be on the population that we're serving. What's the end result? How is this affecting the youth? What's in the best interest of the youth? And I really believe that many hands make light work. And I also believe that if nobody cares who get the credit, we can do more work also. I think one of the key issues when you're talking about collaboration, and I've talked to Victor several times, anything with gang, Victor, I'm picking up the phone and calling him, and he investigated one youth that was in my program at the time. Now, Carlton, that's not really what's going on. I dug a little deeper. It's knowing your personnel also, right? Who's the subject matter expert in this particular area, right? Let me call this person because I can depend on them for some sound advice and some information that's going to make the outcome of the youth or the young adult that we're serving as best as possible.
Egos need to be left at the door.
Yes, sir.
I've been in this a long time. Egos, leave them. Politics, there's no need for politics when we're talking about kids. That's just my opinion, right? Somebody might say something different. But when it comes to kids, man, we gotta really look at what's really going on. And I watch egos get in the way, agendas, get in the way of doing some good work, funding not going a certain way, jealousy, they do this, they do, I don't care what you do, man. Do you, I do me, we come together, we do together. And the people are gonna benefit from it. I've been around so long that was probably one of the biggest things I had to get over was ego. It was like, leave those people, don't mess with them, they don't think like you, they're not in that same mindset or space that you're in. They'll come back around. They just need to be educated. They need to understand what gang violence is. They need to understand why kids play with guns and use guns the way they do. They don't understand yet. They come from a different space. So it's a matter of us being able to educate. But man, egos, gotta leave them at the door. I can't say it enough. Egos gotta go.
All right. Well, thank you all. This question, I believe, was directed at Carlton Harris. The question is, can you elaborate on the iceberg model and how it may apply in other areas in firearm injury prevention?
Absolutely. So the iceberg model is the majority is beneath the surface, right? So if you just imagine the Titanic when they hit the iceberg, you only see a top of it, but the majority of it is beneath the surface. So when you're working with youth and young adults, we see the behavior, but you don't see the thoughts, you don't see the feelings, you don't see the emotions, you don't see the beliefs, you don't see those internal things. We see the external manifestation of their thoughts or the external manifestation of their beliefs. I often put it this way. Through our eye gate and our ear gate, things enter into our mind, which creates a thought, but it manifests in our behavior. So if I want to do behavior modification, I need to work on the transformative thinking. But if I want to transform the way that they're thinking, I have to change what they're seeing and what they're hearing. So when we have youth that are going back into the same environment, that are continuing to see crime and violence, they're becoming desensitized to it, and it's becoming normal. So what's abnormal to us have become normal to them, right? And so this is their thought, this is their belief, this is their emotion. This is what some people categorize as our youth being resilient, but it's really that they've just become desensitized to what they've seen every single day, that it becomes normal. And I'll use an example of a young man that I was mentoring through our diversion program, and he told me when he first met me, he didn't know my story, didn't know my history, didn't know anything about my upbringing, and he said, "Mr. Carlson, you don't understand. I see death every day." That's what he told me. So I think really having a good conversation with the population that we're serving, digging a little bit deeper, stop trying to put a Band-Aid on something that needs surgery, and really getting to the root cause of the problem. Because even if you look at crime, crime is associated with economics. The higher the crime rates are in the most underserved communities where there are lack of opportunities. So it's like hand in glove. So those are the things, that's the iceberg model. The things that are not seen, the things that are internal, the things that we take for granted that this young person understands thoughts, beliefs, emotions, when we understand that the frontal lobe of their brain is still fully developing, and not fully developing until they're about 25. So you can use that iceberg model in any situation as it relates to crime and violence. And again, I think about myself learning to shoot a gun at 7. That was a taught behavior. My uncle literally put the gun in my hand, held my hands up in the air, and helped me pull the trigger and said, "Now you are a man." I learned that. And so from that young age, it framed my thinking and my belief system that I'm not a man unless I know how to operate a firearm. And I learned that at 7, and it carried me to my teen years, which ultimately led me to making bad decisions and bad choices. That was a contributing factor.
Okay, unfortunately, we only have time for one question, and this was for Victor. So you're clearly very passionate about your work, and thank God for you. First of all, how can you meet the needs of the entire city with only 9 people?
I ask myself that all the time.
We need about 100 Victors out there. And then secondly, how does your program evolve and grow in settings where you did not always have support? And I think that's indicating, you said there's certain areas where you work. How do you pick those areas, or how do you find new areas? How do you evolve and grow?
So learning from the comprehensive gang model, what I learned was, I'll never forget when they first came to Houston, and they put the model in my neighborhood where I grew up. And I'm listening to these folks from Chicago and OJJDP out of DC, and I'm listening to them, and I'm like, man, y'all know nothing about my neighborhood. What are you gonna do to change the way things are in my neighborhood? And I laughed and I laughed, and I sat there, and I was young and full of myself. I got this. And it was the base that I had to work from, and it was an assessment that I needed to understand. It was something that HPD had all that information. I didn't have it. They weren't going to give it to me. When I moved into the mayor's office, anti-gang office at that time, Adrian Garcia was our, Commissioner Garcia now, would share data with me, and I was looking at the data. But my my work in the nonprofit for many years, I would hear about other sides of town. I knew of other sides of town because I would work near the area that I was working in already. So I knew a little bit about the streets, but the assessment, being able to do an assessment and see I'm very visual, watching what was going on paper and matching it up with what was going on the streets when we were doing the work has to match for me. Each area of the city, I mean, there was always top 3 or 4 areas, and so I look at those top 3 or 4 areas, and they don't change much. The year that something is going on, the activity may change, and the bodies and the people change, but the cliques are still there. South Lawn, Big Bed, Free Money, you got Murder Mob, I got Cholos, Primera MS, I got Brown Pride, I got, Five Deuce Hoover on this side, 5'9" Bounty Hunter on that side. They link up, they don't link up, we operate separate, 60s do this. The ability to be able to understand that allows me to understand where my staff needs to be, because we can't be everywhere. So I'm in the schools in that area, I'm in the parks in that area, I'm in the apartments in that area. If there's projects, we're in the projects in that area, and we stay doing service in that area. Does it take us to another side of the freeway? On occasion it will, but it doesn't mean that I'm going to just stop doing what I'm doing here. When I heard what was happening with the health department, both city and county, and I heard Lupe and them were going up that way, much needed help. Things have calmed down. They still got some drama, stuff still popping off, but at least now there's additional bodies, and it's a matter of sitting down with Lupe and figuring out, what are you doing so I don't step on your toes and you're not stepping on mine. We're doing what we need to do and do it effectively. So I have to be able to be very smart in how I do this. Those meetings, those gang violence reduction team meetings, it allows me to be in areas where I can't be all the time, because the people that work that area are there. My staff, probation, parole, law enforcement, school folks that work that area. We're working with people that are dealing with the kids that are in those gangs causing all that violence. That's how I keep up with it, because there's no other way to do it. Now, can I get to the suburbs every now and then for a phone call? I'll try, because the suburbs do have their issues. Can I get to other areas that are maybe a little quieter? If I have to service them, I have to service them, because we're city government agency, and I'm not going to turn my back on a parent that really needs help, but I have to concentrate on my staff's efforts and where we're going based on data. I have to look at it, and then I compare it to my street knowledge and what I've been doing all these years, and pass that on to my staff.
Okay, great. Thank you so much. I think we're out of time. Thank you all.
Thank you.
Thank you.
Thank you. Appreciate it.
What amazing work that's being done in our Houston area, and I'm just incredibly proud to be here and to learn about all these amazing programs. I have the joy of bringing it all back home and to go over policy with everyone, because that's the piece here that we're all talking about and going over, is how do we impact or understand how to impact policy. So we're going to go over an overview of federal, state, and local policy. I have no relevant disclosures, as I did earlier. I had no disclosures. So we're going to go over some historical context as well as an overview of the legislative policy. This is by no means meant to be comprehensive, so because there's a lot of policies about firearms, but we're just going to try to focus on the firearm policies at federal, state, and local levels, and review some of the impacts of those policies on firearm ownership and injury, and also talk a little bit about what's currently going on the federal level as well. So everyone knows, as we start talking about policy, we have to start with Second Amendment, or 2A, and certainly when we think about Second Amendment, everyone talks about how whether or not this is the debate between the militia versus independent individual right to carry. So recall, at the time of the drafting of the Constitution, the Federalists versus the Anti-Federalists made two general concessions. Number one, they gave the Constitution total legal authority over the Army and the militia, but at the same time, they granted that the federal government should not have the authority to disarm the citizenry. So that's why you have these two together, right? But they did also say at the same time that the federal government could grant the states the right to regulate guns. And so this 2A is kind of how it was drafted originally. This was further codified in the 14th Amendment to state that the individual right to carry guns was granted, because recall, black men did not have the right to carry guns until the 14th Amendment after the Civil War. And so 14th Amendment further solidified, yes, the individual right to bear arms was granted. So what we saw afterwards was a series of key federal firearm acts. So in 1934, we saw the first regulation in manufacturing and transfer of firearms through our favorite form, taxation, right? And so we also saw some regulation of some very narrow scope of firearms. In 1938, we saw the creation of licensing requirements for those who manufacture, import, or sell firearms, the creation of the Federal Firearm Licensing, the FFL. And so for those that go for licensing, we talk about firearm retailers being FFLs. This is where this term was originally oriented from. It also required record keeping for those who sell firearms and prohibited certain sales, like you couldn't sell to someone who was a felon and things like that. And this was law of the land until 1968 with the Gun Control Act of 1968, which is the current law that we have right now. And as you can see, it has a fairly all-encompassing prohibition of the sale of firearms for folks who, are unlawful, fugitive of justice, if you're addicted to a controlled substance, underage, dishonorably discharged from the military, convicted of a misdemeanor of domestic violence, subject to a court order or a restraining order from harm for domestic violence or child abuse. But it does not include those who, are on the terror watch list, so that's something to be considered of, or does not include those if you've had a juvenile offense or convicted of a violent or gun-related misdemeanor. The Gun Control Act of 1968 also provides for background checks when purchasing from someone who's engaged in the business of dealing firearms. So the way the language is written is kind of vague, right? So it excludes those who do occasional sales, hobbyists, someone who does a personal sale. So it really is kind of this loose definition of who is someone who sells firearms and someone who does those regular sales. What we saw with this was in 1968, we saw the Firearm Owners Protection Act, and this really liberalized some of the restrictions on firearm sellers also. It allows for FFLs to also sell at gun shows, as well as it prevents the federal government from having any kind of central database on the FFLs for having record keeping. So no central database is allowed. We also saw in 1993 the Brady Handgun Violence Prevention Act. And so this instituted a 5-day waiting period for purchasing a handgun to allow for the completion of a background check. So that's important to recall, okay? So this allows time for the FFL to work with their local firearms or their local law enforcement in order to complete this background check. And so this was law of the land up until, we start doing our instant background check systems. In 1994, we saw the passage of the federal assault weapons ban. And so this prohibits the manufacturing, transfer, and possession of semi-automatic weapons, prohibit large capacity feeding devices, and also banned 19 specific models by name. So this was passed in 1994, and it had a 10-year sunset provision. So it did sunset in 2004, and it was not renewed at that time. In 1996, we also saw the Dickey Amendment, which prohibits any federal funding from the CDC to be used for research on gun control. The Dickey Amendment is still active. As a result from this, there were no funds that were dispersed for firearm research until 2019. We also saw in 2005 the Protection of Lawful Commerce in Arms Act, and also the Child Safety Lock Act. In the Protection of Lawful Commerce in Arms Act, what that does is it prohibits any qualified civil liberty action in either a state or a federal court against a manufacturer or a seller of firearms or ammunition. So what that means is without any kind of exception. So unless there's a defect in the firearm or in their warranty, or if you knowingly sold the firearm to someone who is going to perform some kind of crime, you aren't allowed to prosecute or bring a lawsuit up against the firearm manufacturer or a seller. Also with that act, they did require that every handgun sale or transfer needed to include a safety device, either a locking device or a safe storage device. In 2007, we saw the National Instant Criminal Background Check System Improvement Amendments Act. So what this did was it provided financial incentives to states to use the instant background check system. So states could then start doing these instant background checks. What this essentially did was nullified the Brady Act, because remember, the Brady Act was only in place to do the 5-day waiting system to allow for the background check system to happen. So if you have an instant background check, you no longer need a 5-day waiting period. What we saw was several Supreme Court challenges in order to challenge the Second Amendment, and these are the two most notable ones. In 2008, we saw District of Columbia versus Heller. In District of Columbia, they attempted to forbid the ownership of firearms, and it was deemed per the Second Amendment what deemed for the Supreme Court by a ruling of 5-4 was no Second Amendment rights do hold up individual right to carry, and the District of Columbia could not restrict ownership to individuals at that time. What we saw in 2010 was a similar legislation that was passed by the city of Chicago, where they tried to forbid ownership of firearms within the city of Chicago. Again, the Supreme Court ruled 5-4, no, you cannot ban ownership of firearms within a person's home. But they did state that you could ban possession of firearms within certain areas of the city, right? So you can say, no, you are allowed to own your firearm in your home, but you can restrict locations within the city where you can have them. But they also did another step forward, and they said that, you know, what cities could not do is that they could not pass legislation on weapons where they were not typically possessed by law-abiding citizens for lawful purposes. So it's important to remember that language, right? Because that had a significant influence on firearm ownership in America. So what you saw here was a lot of people had theorized that after the sunset provision from 2004, remember, the firearm assault weapons ban was passed there. I'm going to see if this pointer will work. Is it working? Yeah. Oh, here we go. So you saw here in 2004, right? That was when the assault weapons ban was lifted. And there was a theory that people would go out and want to buy a bunch of assault weapons and rifles. And so in this, this yellow line is where the rifles are. And you did not actually see from 2004 until 2008 any real increase in that mass purchasing of rifles. We assumed that there would be after that, but there really was not when you saw this lift of the assault weapons ban, right? You saw a little increase after 2008, and that was expected because there was this concern with the election of Obama that he would somehow reinstitute the assault weapons ban, and so there was a little bit more of a purchasing there. But you really see it take off around 2010, and that's for both pistols and rifles. And the reason you see this is because of this language that was introduced with the McDonald versus City of Chicago Supreme Court decision, with this language around not typically possessed by law-abiding citizens for lawful purposes language, right? And so the idea was firearm owners were wanting to mass purchase firearms because they wanted to show that law-abiding citizens were owning firearms for lawful purposes. And so you saw this mass purchasing, and you can see the effect of that legislation and the impact of that from the Supreme Court decision there. Other impacts of federal legislation, we saw significant ones on research. Firearm injury and gun violence is the least researched cause of death, and the second least funded cause of death after falls. Falls is the least funded. Falls is way down in the corner there. And then you can see, you know, when you look at all these other, if I can, this is very difficult with this pointer. I'm going to just give up on that. You can see, you know, as far as when it looks at firearms in red, you can see comparatively there's more annual number of deaths. Oh, I can aim at the screen too. Ah, look at this. Okay. There's more annual number of deaths in firearms than there is compared to prostate cancer, and then comparatively amount of funding from prostate cancer here versus the amount of firearm funding. Significant differences, right? So the amount of funding in dollars that we invest in our research to firearms is significantly lower compared to the amount of deaths that there are. Direct impact from legislation. What's currently going on in the current legislation from a federal level, 2022, the House passed the Protecting Our Kids Act, which did call for the raising of the purchase age for the semi-automatic centerfire rifle to age 21 years, banning bump stocks, restricting those large capacity magazines, also implementing gun buyback programs, prohibiting those straw purchasing. For those who don't know what straw purchasing is when you go in and you are intentionally wanting to purchase a firearm and then giving it to someone who legally cannot purchase a firearm on their own. And then also requiring all firearms to be traceable. This is kind of restricting those ghost guns, or like creating your own like 3D version of your firearm. And then also making enhancements to our safe storage laws and implementing grant programs to improve safe storage. What we have in our bipartisan Senate framework, we don't actually know what the legislative language is, so I really can't comment as far as what that really is. The official language has not been released yet, but this is what the framework has been proposed, is to incentivize states to incorporate red flag laws and enhancing those background checks for purchasers who are under the age of 21 years. Also closing the boyfriend loophole, because again, you can't, you prohibit sales on people who are convicted of domestic violence, and also for those who are have a restraining order against them, but not necessarily for those who are involved in non-marital type positions. So you're looking at like people who are maybe not cohabitating with someone. So you have this like boyfriend loophole. What if your boyfriend is someone who is in a domestic violence situation? So they want to close that loophole in there. The bipartisan framework also calls for a stricter definition of what an FFL is. So that way you can really further define this engaged in the business of dealing with firearms a little bit more stricter, so that way we can maybe enhance who's requiring to do those background checks, as well as increasing mental health and school safety funding. So that was a whirlwind tour of the federal legislation, and we're going to move on to the state. And if you wonder where the state of Texas lies on their beliefs on firearms and our rights to own firearms, it's in Article 1, Section 23, right away at the very beginning. It's in our state constitution, where we have the right to bear arms, and that the state wants to grant that very immediately to us. In Texas, our ownership laws are that you have to have a minimum age of 21 to purchase a handgun, because that is the federal law. Our minimum age to purchase a long gun is 18 years. However, minimum age for possession of a firearm is really, there's no minimum age as long as you have permission of your parent or guardian. So you can be gifted a firearm at any age in the state of Texas. If you want to officially transfer a handgun to someone, then federal handgun transfer laws do apply. In Texas, I kind of approach this as a do and do not type approach, because there's a lot of laws and regulations around firearms. So in Texas, our laws do not restrict types of guns. So we don't have restrictions on ghost guns or untraceable guns. We do not restrict any kind of bulk sales, so you can go in and buy as much as you want in a single sale. We don't restrict on sales of assault weapons or high capacity or high caliber, like your 50 caliber firearms. We only require those background checks for the FFLs, so they're not for universal sales or for personal or individual sales, or even at gun shows. We do not require licensing, we do not require registration, and we do not require someone to report loss or theft of their firearm. What we do require is we regulate the sale of armor-piercing bullets. You cannot buy ammunition if you are intoxicated or if you are within 5 years of incarceration from a felony. We prohibit possession and sale of fully automatic firearms, so no machine guns in the state of Texas. We prohibit straw purchasing, and we prohibit selling firearms to someone who is knowingly lying on a background check. In Texas, we have been allowed to carry long guns for a very long time, and in 2021, it was passed that you are allowed to openly carry a holstered or a concealed handgun without a license. You are allowed to use lethal force in Texas when defending your property, and we also have the stand your ground doctrine, which removes the duty to retreat before using deadly force. In Texas, state law dominates. What this means is we have preemption laws in municipalities and counties, which means state law supersedes any and all local laws. It goes even further that we have joined 5 other states in the country to become a Second Amendment sanctuary state through the passage of that act in 2021. What that states even further is that there is legislation that not only prohibits but also penalizes local governments, public employees, and law enforcement from providing any assistance to a federal agency in imposing any restrictions restrictions that does not currently exist under a Texas law that relates to any registry, licensing, requiring of any background check on private sales or transfers, including gun shows, and also any confiscation programs. So Texas has made it very clear that Texas state legislation is in charge of developing the policies around firearms, and this is where they are the decision makers on those policies. In general, in Texas, whenever there's gun violence, the tradition is that in the gun violence, it usually loosens the restrictions on carrying firearms. And we've seen that especially after Sutherland Springs, where churches were then allowed to have parishioners carry guns in services. And then we also saw constitutional carry or permitless carry happen after El Paso. Texas is one of 34 other states that has child access prevention laws, which allows for criminal liability for negligent storage. So there's three types of general types of child access prevention laws, which are a child may access a firearm versus that they have accessed a firearm versus that they have used a firearm. Texas law falls into the have accessed firearm, in which it penalizes an adult if a gun is readily dischargeable and accessed by a child that is under 17 years of age. And the evidence around this CAP laws or child access prevention laws are that they can reduce suicide and unintentional injuries and deaths by children by 54%. ERPOs or extreme risk protection orders or red flag laws. Texas does not have one, but they are ones where, family members or law enforcement can temporarily remove a person's firearm if needed, if they are deemed an imminent risk to themselves or others. In states where they have been implemented, they've been shown to reduce suicide between like 7 and 14%, and have been theorized that they may also help prevent mass shootings and gun homicides. 19 other states in the District of Columbia have these orders in place. What we do see is states that have strong firearm safety laws do correlate to lower firearm-related pediatric mortalities. And what you see in states where they have universal background checks for the 5 years previous, you saw a 35% decrease in the pediatric deaths related to firearms. And what you see in this graph right here, states with stronger firearm laws have lower pediatric mortality rates, and those with weaker laws have higher pediatric mortality rates. The governor's action to gun violence, we saw this picture earlier, the Santa Fe roundtables, where they initially called for a variety of things in their response to Santa Fe. And what came out of there was Senate Bill 11 in the 86th legislature, which called for school behavioral threat assessments, where they looked at comprehensive programs in order to identify children who might be at risk of hurting themselves or others, and how to identify them early and to implement intervention programs in order to help prevent any events that may happen, expanding mental health interventions, creating the Texas Mental Health Consortium, funding and increasing schools' securities, as well as implementing bleeding control measures to be taught in schools, and creating a task force within the Texas Education Agency on mental health services and training, and appropriated $100 million to this service. What we saw after El Paso and Midland, Odessa was the creation of a statewide active shooter alert system and the passage of the Lie and Try bill, making it illegal to lie on your background check, and also the passage of permitless carry. We also saw the passage of the Keep 'em Safe Texas program, which is a partnership with the Texas Department of Public Safety focused on safe storage, as well as in 2021, the waiving of sales tax and the promotion of tax exemption for purchasing of safety devices. Moving on to our local policy. Surprisingly, there's not a lot because we have preemption laws that exist that restrict what local regions can pass. So largely the things that are specifically related to Texas local policy restricts on reckless discharge of firearms, and you're not allowed to hunt in the city, in case you were wondering. But we do have the opportunities to do intervention programs and campaigns, and that's where a lot of the funding, and you guys have heard a lot about these programs already, so I'm not going to spend a whole lot of time focusing on that. But our Houston Safe Storage campaign that you've seen through the District Attorney's Office with 25 billboards that are across the city, the PSA that you guys had the opportunity to view at lunch, and then cable lock programs, and even partnerships with our HISD program, our schools, to train adults and parents and staff on safe storage, and even partnering with Academy to have their logos displayed to view the importance of safe storage. And for those that didn't have the opportunity to view at lunch, if you just go to YouTube and then type in the search bar, the importance of safe storage, you'll be able to pop up the video and view it for yourself. And then many of the Houston programs and the investment that the city has done into these programs has really been commendable, and the panel before us really got to highlight many of these intervention programs, as well as the Mayor's Commission Against Gun Violence, bringing together this very diverse group of key stakeholders to provide these recommendations on legislation, budget, because we all know if you don't fund something, it can't be really successful. And I'm just really amazed to hear what many of these programs and policies were able to do with such little staff. Really, when I think about it, I'm like 9 people for the whole city of Houston, and look at what you can do with those. So really give people a little bit of money and they can stretch that quarter to make it last, and see how we can make these interventions. And then also the One Safe Houston program, which was just launched, and we heard so many great things about the One Safe Houston program already, to really see how we can intervene and reduce crime and violence in the city and really make an impact on firearm injury prevention. So again, not going to speak a lot about this other than this is another great example of how we can use local policy approaches through fiscal investments, and you don't really need to have those policy investments in order to impact firearm injury. So knowing those levels of policy, knowing where those spheres of influence can be, because you can't really work on a local level at passing policy from different ways, but you can intervene through those investments is really knowing. So thinking about, is this legislation, is this regulation, can you go this through a different funding route is going to be an important thing. And knowing who your decision makers are is another key thing. And when you think about who your decision makers are, you can use some information to help influence them. So looking at things like the gun violence poll, which was recently pulled, the data was pulled from this right after Uvalde. And this was a fairly balanced poll from, you think about it, from Dems and Republicans and independents. And this is the data from just firearm owners. And they were asked, would you support a representative if their policy was that they would require background checks for gun shows or private sales? 69% said definitely yes. And then would they support red flag laws? 61% said definitely yes. So this is information that you can share with folks as well and decision makers. So when we think about what influences policy, these are the 3 things that influence policy: scientific knowledge, social strategy, and political will. And so what we're talking about here today and here at the Baker Institute is developing that scientific knowledge, right? So we get the information, we get that research. We've heard a lot about today with the research to policy. How do you translate that research and that information into something that legislators can digest and use, and be able to translate that into something that can become and influence the social strategy, right? And how does that social strategy then that we've seen and implemented in there, how can you take that and how does that translate into political will? But you need all 3 of those in order to influence policy. And so understanding policy is an essential key, because you have to understand the background behind the policy in order to understand why things are the way they are today. Why is this such a difficult conversation to have? You have to understand the background behind it in order to be able to address the policy, because it's not just as simple as saying pass a bill, right? The history behind it is important and imperative to understand. And understanding the research is important in order to provide the evidence, because the evidence can help us divide those viable social strategies, because we did that very effectively. You can see here in this graph, we used our research and our evidence to come up with the social strategies in order to reduce motor vehicle crashes, which is that first blue line. We did that. We came up with car seats, we came up with seatbelt laws, we defined better roadways, speed limits. We made our intersections safer, and we helped children not die from car crashes over decades. And now motor vehicle crashes are not the leading cause of death in children. It's firearms. So there's no reason to think that we can't take a similar approach in order to help reduce firearm injury and death in children. So thank you so much for your time. I believe we are up to have Dr. Knott give us a few closing remarks.
Thank you, Sandy. That was great. Before we move on to the coffee break and then our panel session with our city leaders and state representatives, which we're all very, very excited about, I just wanted to summarize what we've learned today. Some of you came in after lunch and may not have been here for the morning sessions, so I just wanted to put everyone on the same page. So first of all, we heard from the mayor this morning, which was a real treat. He had a very strong message about gun violence, how there's a lot of guns in Texas, how it's increasing, and how we've put programs into place that they do seem to be working, but there's a lot of work that needs to be done. Then we heard about some research here in the Harris County area that showed that about 2,000 adults are injured by guns per year. That includes fatal and non-fatal injuries, and about 200 children are injured by guns per year. We learned that between 2018 and 2019, there's been an increase in gun violence in children by 76%. We learned that homicides are more common than suicides in adults in Harris County, which is different from the national numbers where suicides are more common, which shows how many homicides we have here. We learned that unintentional or accidental shootings in children happen very often. Almost 20% of children who are injured are shot by this, and that firearms from at home, family firearms in homes of people's homes and families' homes and friends' homes and cars are responsible for the vast majority of unintentional shootings and suicides. We saw some of the hot spots and the areas where these things are happening. We saw some of the differences based on shooting intents. We saw the trend of firearm violence in Houston, which goes through peaks and valleys, and unfortunately is on an upslope here and may not be at a peak yet, but most likely it's going to get even worse before it gets better. We heard about safe storage and interventions such as training residents on how to provide safe storage guidance. We learn about perceptions that firearm owners have regarding safe storage, how gun retailers can be very helpful partners as their trusted messengers. We heard about a wonderful public campaign in Austin that has been funded by the city and that has had great outcomes and great results by a very passionate parent who lost a child to an accidental shooting. We heard about suicide prevention in veterans, and although in a really wonderful program, the Vision Coalition that has done a lot of work in that arena. We heard about the rising mental health crisis in teenagers and the TCHAT program, which is telemedicine counseling for students in schools, that is funded but could probably require about 10 times more because this is a really big problem. We heard about violence prevention interventions for firearm violence, but also dating violence and other teen violence. That should be good for all children, not just children in affected areas, but for all children and starting at a young age. We heard about how to talk to policymakers, translating research to policy. Then in the afternoon, we heard a wonderful perspective from a trauma surgeon, a day in the life of a trauma surgeon, and how much gun violence we're seeing here at our trauma centers in Houston, how bad it really is. We're all siloed. We all care about this greatly, otherwise we wouldn't be here. But sometimes we all don't know what each other is doing. And so I think it was really nice for others to see what we see, and then for us to know what goes on in the community, because that's not something that we hear about a lot from the medicine side. And so hearing about all the wonderful community-based programs that we have, the One Safe program, that's an example of great use of federal dollars. The City of Houston anti-gang interventions, the Harris Health Public Health Department and the Houston Health Department, and all the programs that they have that are separate but equal, it sounds like, and everyone doing wonderful work together. And these are all fairly new, so I really hope to see some great outcomes from them in the years to come. And then finally, we heard from my partner, Dr. McKay, about policy at the state, federal level, and that wraps up the day. So that was a quick tour of what we've learned today. It's been so wonderful to see everyone here. Thank you so much. And thank you so much to the Baker Institute for hosting this fabulous event. We hope to have more of these. So this is just the first. And next we will move on to the coffee break. Thank you.